Hi everyone, Dr. Nemechek here. I want to talk about what relapsing looks like if you say you stop the protocol and things seem to be going pretty well, and at some point your gut bacteria is going to relapse. Now, a lot of people don't feel that. And then what does it look like? How do you know? So, quite frequently, and I think this is just partially human nature, they'll be on the protocol, they're doing really well, 6, 8, 12 months out, whatever it is. They start, I think, just life intercedes, and they miss some fish oil here, they miss some olive oil there, they're kind of doing okay. They've stopped their rifaximin, and their gut's kind of doing okay, and they think they're fixed. All right, and in a sense they are. I mean, they're functioning at a much higher level neurologically. They've recovered, but what do they look out for? Well, what happens is when the inflammatory stress starts rising again. So that's going to start rising just from the food supply. So if you're off the olive oil and fish oil, your omega-6s and 3s are going to get messed up again, and you're going to be kind of in this pro-inflammatory stage. So that can start rising up a little bit. It might not be enough to notice, or it's just a little bit. You might have, if you originally had a little joint pain, that might kind of come back on occasion and so forth. But from a neurological standpoint, what you'll see is your prior areas of injury are going to kind of start to come back. So if you had, so the low blood pressure problem, and say your low blood pressure symptoms were migraine headaches and some generalized anxiety and fatigue, that slowly, it's going to start coming back. It just depends how much inflammation is really present in the bloodstream. Now, if your gut bacteria relapses, and again, about a third of patients don't have any symptoms when that happens. So you may not know that. You're going to have a lot of inflammatory stress in the bloodstream. And typically within 1 to a couple months, people are going to start noticing, wow, I had a couple migraines this month. What? And gosh, I really, at the end of the workday or whatever, you just can't focus very well, and you're feeling a little antsy and, a little anxious. That's how it kind of comes on really slow. You got to watch out for it. And often, if you're married, your spouse will notice before you notice, because they can just tell you're off, And so you got to really watch out for that. And we don't know how to permanently fix bacterial overgrowth. So, and if you don't have any symptoms of that, it can be hard. So you got to really pay close attention. And if, say it's migraines or whatever your symptoms, and you say, hey, I've had that a couple times here lately. I mean, it shouldn't be, I wonder if SIBO is back. SIBO's back. You got to treat it. Now, if you overtreat occasionally, say it's not back and you treat, you're not going to harm yourself. This stuff's super safe, doesn't get in the bloodstream. So that may happen on occasion. We just don't have the ability to do a throat swab like for strep or something to tell us. So we have to kind of use these clues. And so that's kind of how it looks. So you got to have kind of a low threshold, because it's always going to be coming back. For me, when SIBO relapses, I guess I'm lucky in a way that coffee and red wine start to make me sick. And my right shoulder hurts and my eczema flares a little bit. I can tell within a couple days. So if you have any symptoms like that, you can cue into, use that and treat with another 10-day course of rifaximin. So I hope that helps. And my advice, always stay on the fish oil and olive oil, because the food supply ain't ever going away, and that inflammatory stress from that is going to be affecting you negatively no matter how you feel at the moment, because the first sign of that inflammatory stress could be, bingo, you get breast cancer or something. Okay, so you got to stay on top of that, and then just kind of the intermittently using the rifaximin depending on your other symptoms and how well they're controlled. Hope that's helpful. Everybody have a great day.